Good afternoon, Koyana Jamai, Chairwoman Ledger Fernández, Ranking Member Orbernolte, and distinguished members of the subcommittee. My name is Alberta Unok, and I am the President and CEO of the Alaska Native Health Board. ANHB serves as the statewide voice for the Alaska Tribal Health System and provides services to over 180,000 Alaska Native people. First, I would like to express appreciation to the late Congressman Young for introducing H.R. 5549, which would extend advance appropriations to the Indian Health Service. Congressman Young served Alaskans for nearly 5 decades, and he understood how critical this bill is for the Indian health system. He introduced it in 5 consecutive Congresses, going back as far as 2013. IHS advance appropriations has been supported by the Biden administration. It is widely championed by tribal nations, and the Government Accountability Office also recognized the benefits of IHS advance appropriations. In short, this has broad support, and we are closer than ever before to having IHS on an advance appropriations funding schedule. This would ensure critical health services are not delayed. It would have little impact on the overall federal budget, but it would have major impact on IHS and the people they serve by providing stable funding. IHS remains the only health program that is not advance funded or funded through a much more stable mandatory funding mechanism. IHS advance appropriations would increase access to health services, improve health outcomes, help to maintain flexibilities, maintain facilities and infrastructure in a timely manner, enhance planning, hiring, and increase the quality of care through stability and flexibility in our programs. Continuing resolutions results in its own apportionment process, which requires reconciliation efforts. The GAO found that IHS and tribes are given significant administrative burden due to the fact that IHS has to modify hundreds of contracts each time there is a CR. These are resources that could be otherwise provided directly to patient care. Short-term funding creates the need to shift funding to support the most critical, life-saving services and prevents tribes from planning or moving forward entirely with needed facilities improvements and expansions. Tribal health programs are left to make long-term decisions with only short-term funding. Federal government shutdowns create an even more dire situation. Tribal health programs often operate on very thin margins and are forced to cobble together resources just to keep staff in our rural and remote clinics. In many cases, the Alaska Tribal Health System is the only provider in our rural villages. In Alaska, 80% of our communities are off the road system and therefore rely on large bulk purchases of items such as heating fuel to support operations. For the same reasons, the transportation of construction materials must be transported to villages via the barge system, requiring advanced purchases. The IHS Tribal Budget Formulation Work Group recommended funding IHS at $49.8 billion in FY 2023, yet current IHS funding is just $6.6 billion. The FY 2023 budget proposes enacting mandatory funding for IHS. We look forward to working collaboratively with Congress and the administration on the budget, as it would provide a pathway to achieving more stable and adequate appropriations for IHS in the long term. Enacting IHS appropriations will help the federal government meet its sacred trust responsibility by ensuring funding is stable. To conclude, ANHB calls upon the members of this subcommittee to not only move H.R. 5549, but to advocate with your colleagues and on the Appropriations Committee and the Budget Committee to support this bill. Enacting IHS advance appropriations will help insulate critical life-saving health services. Thank you for holding this important hearing today. I am happy to answer questions you may have. Guyana.